Hello, I'm Dr. Sonia Nayyar, and I'm a private practice neurologist here in Apple Valley, and I'm affiliated with Choice Medical Group in Horizon Valley. I'm here to talk a little bit about COVID 19, where we are with it, some of the new CDC guidelines, and where to go from here. So, as some of you may have known, CDC added a few new guidelines to look out for symptoms for COVID 19. While most of us are aware of the symptoms of fever, cough, shortness of breath, some of the new added symptoms include chills, repeated shaking with chills, headache, sore throat, and even the loss of taste and smell has been formally introduced into CDC. Um, this is just a reminder because, of course, it is still going around and it can get intermixed with allergies and other viral illnesses. These are the symptoms to look out for if you're worried about COVID 19. Next, I kind of wanted to spend a little bit time about where are going to go from here. As many of you have known, Governor Newsom just today announced that phase two would be starting on Friday. So, as most of our states, counties are starting to opening up over the next coming days and weeks, I wanted to spend a little bit time about how to protect ourselves when we're going out, and then even a little information for employers how to keep themselves and their employees safe. So, first of all, from a business standpoint, one of the most important things is really focusing on three major aspects. One, universal mask wearing. I think that really goes without any discussion that everybody who is out and about should be wearing a mask. Now, second of all, good hand hygiene. That has really never left the matter, whether it's good with good old water and soap or with hand sanitizer. That makes a very large difference. And then lastly, limiting how many people are in each building. If it's a very small building or very small venue, keeping within that 6 feet or even more would really do a benefit. So, what I wanted to do is really give an example of how some people are approaching this. And I wanted to kind of take an example of my own medical office, High Desert Neurology, because one thing that I've come across is realizing about how many people actually have put off their medical care, whether it's through their outpatient primary care doctor, specialist, or even the ER for urgent needs. I myself have had several patients not go in for concerning symptoms that could be stroke like or even heart attacks. And I wanted everyone to know that medical offices and hospitals are extremely safe. Actually, they're probably one of the safest places you can be at. And so, for example, my office, High Desert Neurology, we've gone through drastic changes to assure your safety and everyone's safety here. So, what we've been doing is basically limiting the number of patients that are coming in. We're limiting the number of patients that are waiting in the waiting room. We're decreasing the number of people that come through the office, limiting family members. We offer telehealth, which basically is chatting through people through video chat so that at least we can do a physical exam, or even the phone to decrease the number of patients coming in. Everyone has to wear a mask, and we've been disinfecting left and right. So I just wanted to give an example of how offices are doing it, because as things start to slow down, I do want people to realize that their medical care shouldn't be put on the back burner, because that can really mean the difference of life or death. Hospitals have also made many changes. For example, I know at Victor Valley Hospital, they've been checking patients for their COVID status a few days prior to their elective status, their elective procedure, and if they are positive, postponing their procedure. And I know the other hospitals in the area are doing that as well. So it's so important for us to make sure that we take care of our medical health. Like I mentioned before, I would still urge caution. So even as Governor Newsom opens up California, San Bernardino County starts to open up, I think we should still practice extreme caution. I would still recommend social distancing, whether you're going out to a park or going to the mall, because remember, it's really to help save our high risk patients, those that are over 60, those that are taking immunosuppressants, those who have diabetes and or asthma. And if you do fall in that category, I would especially refrain from going out. I know that we've been tired from being inside for a very long time, but if you can refrain for just a few more weeks just to see what happens when we open up the county and state, I think you would benefit from that. Uh, Also, I mentioned before that it's quite possible that many of us have been exposed to COVID 19, whether it's been in the past or we will be exposed to it in the future. So I do want to recommend practice that social distancing, limit the amount that you are going out, because until we have either a safe and efficacious treatment and or vaccination, this still is a very, very serious threat to the population. Until then, be vigilant and be safe. And remember, if you have any symptoms, first call your local primary care doctor and or your local ER to get advice about what to do. Once again, this is Dr. Sonia Nayyar, and thank you very much.